So what I'm listing here on this slide are a number of examples that give you some ideas of what you could be measuring in each of those 4 areas. Already alluded to some of them, but one of the objectives here with this presentation was also to give you those slides so you can review them later. So this is the key slide to print out and hang on your wall for some inspiration or to use in a meeting of what metrics you want to measure. So, for example, some input measures as you're rolling out telemedicine services. How many clinicians were trained? How many patients were tech checked? That's a process we integrated into our delivery, especially in the early days of COVID, to make sure that patients had the right technical setup. How many pieces of equipment were deployed? How many of the workflows were defined? And so there's just a number of some other ideas of how you can measure the input that goes into, for example, establishing a telehealth service. The output then, that's what a lot of you are measuring because it's easy to obtain. How many video visits did we have? How many telephonic visits did we have? How many of the visits that we had were billable? You can measure the saved miles or the miles that were not driven, and again, some other areas as well. On the quality side then, provider and staff satisfaction, that's very key, in my opinion, to obtain on a regular basis, not on a daily basis, not continuously, but periodic quality satisfaction checks are really great, especially because it provides an asynchronous way for you to get some feedback. A lot of the frustrations that physicians, that providers experience don't rise to the level that they really want to send an email or mention it to somebody. But if they have an opportunity to answer a survey and have a free form box, I have learned so much from these comments by providers that I've interviewed that was really, really helpful to have those satisfaction on a periodic basis. The patient NPS stands for the Net Promoter Score. That's basically calculated based on the answer of the patient saying, how likely would you recommend this service to a friend or family member? So that recommender, that promoter score. World-class organizations like Disney are in the 70s. It goes up to plus 100. We've launched a lot of telemedicine services where we were at 77 or 80 in the initial weeks, and so that's always good to see how well physicians as well as patients like it. Technical performance, right, uptime or glitches or help desk calls. I mean, there's some other quality measures that you can obtain to get an insight into that technical performance. And then the fourth dimension here, outcomes. So, for example, you could look at no-show rates. It's definitely attainable to get single-digit no-show rates with telehealth and telemedicine because you have the very nice fallback option to give the patient a call and say, hey, we were scheduled for a video visit 3 minutes ago. And they say, oh, yeah, so sorry, I forgot. And then they get on and still the visit can still happen, right? Whereas if you call a patient and they're in the grocery store and they should be in the clinic, you have to bank it as a no-show. So we have other ways to optimize our workflows to design the system that gets the results that we want to reduce those no-show rates. And numerous health telemedicine services over the last year that were reported back to me, we're going from 22-23% no-show rates down to single digits. On the other hand, there was also a telemedicine provider that I talked to that used an kind of online service to book patient appointments, and he had a 35% no-show rate. So obviously there was something else broken in that system that needed to be fixed. The utilization of ERs is always of importance for especially a specific patient population or shared savings programs. You can measure practice loyalty, meaning patient retention. You can find ways to also do a care plan engagement. Again, some of the principles out there is that we have frequent touch points with the patients because it's easy and they don't miss an appointment. They stay more engaged in their care. They fill their medications. They call if they have a question. And so they're just more engaged. And so you can also look at those kind of very quick outcome measures that are not even specific to a particular disease state. Good. So with that, let's move on to that. And yes, the disclaimer that this is just a sample set. That's why we have etc. On all these. It's just to stimulate some ideas here as you go through this and identify in your organization what are the telehealth success metrics that you want to put together across all 4 of those dimensions.